Everyone, this is Dr. Mansi from Homeopathy 360, and today we are back again on the Beyond Boundaries with Homeopathy 360 on the podcast series that is Tips and Tricks to Crack AIAPGT 2025. And I'm very happy to say that today we have another brilliant mind from India, that is Dr. Sourabh Patil. Let me introduce.
Thank you. Thank you, Dr. Mansi.
Yes, sir. Thank you so much for coming on this platform. So let me introduce Dr. Sourabh Patil, sir. That is BHMS Gold Medalist, PGT Part 2nd, MD Homeopathy, Psychiatry from NHRIMH, Kottayam. That is National Homeopathic Research Institute in Mental Health. A very, very congratulations to you, sir. And
Thank you.
And I would like to thank you for coming on this platform, and we are going to learn from your experience, from your tips, from your tricks to crack AIAPGT. It will be very beneficial for all the aspirants of this exam. So, sir.
Oh. Okay. Hoping the same.
I think, sir, it is. I think we are good. We are good to go. So let me begin with the very first question that I asked to all the speaker in this podcast series. That, sir, how do you feel when you saw your result?
So obviously, actually, means it's a really nice experience and nice feeling because the backstory to my preparation goes way back. So finally, while getting a seat, because the purpose behind it was another different story. So like I wanted to have a better clinical exposure. So that's why I was looking for some PG institute with good clinical exposure. So finally, when I got through it, so I had definitely a good feeling about it. So overall, fine. Means it's a very nice, good feeling to have.
Okay. Okay, sir. So, sir, it was it your dream to crack this exam, or you just heard from somewhere that it is an exam, or I should also fill up for this AIAPGT?
No, not exactly. But actually, the thing is, I completed my BHMS, graduated in 2017. So that was the year when the AIPGT started at first. So I was aware about it. Especially there was a novelty around this exam during that time because it was for the first time the national level in exam was being conducted, and
Okay.
actually, yeah. Categorically, it was supposed to be the centralized counseling process as well, but it didn't happen
Yes.
that year because of some lack of infrastructure or some reasons there would have been. So so since beginning, the purpose and the process behind it was to get to some institute with good clinical exposure from the outset itself. So, but it took some time, anyways. But finally, I am happy to be here.
Okay. Okay. Thank you so much, sir.
Yeah.
So, sir, let's come on the very first question. That how early should one start preparing for AIPGT homeopathy?
Yeah. So the question is interesting, and it has got one threefold answer, so as to say.
Okay.
The first thing that the purpose behind the exam or utility basically of this exam is for me is multifold, and mainly like first of all to not only just this exam is to get through to some like process in order to get the admission, because it is primarily the purpose. But apart from that, there is like one of the thing which I personally noticed was the filling the gaps. Basically, during our graduation we have many knowledge gaps. because some or other reasons we'll have some gaps. So while preparing for this exam, somehow we get to know many new things, and that's an enhancement to your uh, previously gained knowledge as such. So that is one. And another thing is the clinical application. So this was one of the revelation for me. I never thought of like preparing for the exam and gaining some clinical knowledge through it. Because at graduation level, we always go through some basic materia medica, like starting with, like first year beginner would start with Allen's keynote by default, and slowly progressively means like curriculum as well as the faculties introduce us with Borik, Fatak, then Nash, Chaudhary, like as we go through Clark and other materia medica. But for this exam purpose, when I went through some questions, I started feeling like somewhere I have seen these questions, like somewhere I have gone through these questions. So I wasn't aware of it. Then I accidentally I had like for example, I earlier had attended one clinical session of Dr. Sunilmal Sarkar from West Bengal, sir. So sir used to means he has got a vast materia medica knowledge. So through his knowledge, he used to tell many things. So I used to underline and mark it as a star and then assess his initials. So and somehow while like practicing for the MCQs, I got to like it was coincidence or what, I don't know exactly. But those questions were coinciding with whatever the clinical tips he used to share. So both way, suppose if a person or if a candidate is having interest in pursuing homeopathy as a career, obviously for that reason he would opt for the further education. So additionally, this clinical experience will also get added on while preparing for this exam. So that was another revelation during the preparation. So, so the question, getting back to the question, how early? So the answer is as early as possible.
Yes.
Uh,
Okay.
yeah. So and like that also depends on the purpose. Like for example, main is to get through the exam. So 1 year preparation, serious preparation is enough. To be honest, like it involves the like back end preparation for the theory part as well as the MCQ questions. So that is the ideal period. Okay. But in case, just in case, like for example, the series is being conducted just at the outset of the exam, which is about to begin in July. So for the short notice, or at least for 6 months, if not 1 year, at least 6 months period is very essential. During the time period during which we can still go through the main crux of the syllabus and still get some idea, or we can have enough abilities to get over like sufficient marks for this exam, I feel. So,
Okay.
so one sentence answer is 1 year is essential for the preparation.
But sir, we have to also clarify the participants that if you are giving a enough time in the 24 hours, then 1 year is beneficial.
Yeah, that's also a
That's
really
also
very important
important.
point.
If
Yes, yes, correct.
if someone is thinking that giving 2 or 3 hours only per day, then it will be difficult for the participant to crack this exam. Am I right, sir?
Yeah, sure. Means exactly the point.
Hmm.
And additionally, during that 1 year, like more than means exactly the hours are important, but at the same time, the consistency is what makes the preparation different person to
Yes.
person. So that consistency is one of the like precursor or
Huh.
prerequisite for this preparation. Yeah.
Okay. Yes, sir. Truly said. And sir, I would like to ask you another question for the preparation also. That
Mhm.
many times I have heard that from my seniors and from the other participants or who have already cracked this exam, they
Mhm.
said that during their preparation period, they almost they go to the underground, like they do not go outside their home or their room, and
Mhm.
many times they do not connect with the outside world, like
Mhm.
they stop their social media, they stop contacting friends and other family members. So sir, is it true that it is mandatory for the for
So,
cracking this exam? Is, I mean, I just want to ask that many participants get this fear, like, is this
Mhm.
exam is this much difficult to crack that you have to sacrifice your companies,
Mhm.
your other things?
Mm, so to answer, actually, it's not that difficult, to be honest.
Okay.
Then, and also it doesn't
Hmm.
require this much sacrifice. Yes,
Hmm.
definitely, we need to avoid the distractors.
Hmm.
So we have to have some moderation over the
Huh.
social media usage,
Huh.
especially given the time that the time period during which I prepared or started preparing, and then coming through these years. So I
Hmm.
have observed that the access to the information was as well very less during that time. So slowly,
Yes.
especially around 2020s, like COVID time, the access to
Hmm.
the information has increased. So we can't totally like boycott or abandon this social media, especially given the fact that now the data has been democratized.
Hmm.
Because if we see earlier, the ratio of PGTs or students getting through the MBA entrance exam and getting to the colleges, it was in strata, in cohorts, maybe in the West Bengal, then Delhi and
Hmm.
Kerala. So three were like major epicenters. And additionally, there was like Hyderabad or Telangana to say. So these were the places where this process was centralized. But now that especially me being also like one example, like I'm not belonging to the states where there are any government homeopathic colleges, and there is no like precursor guidelines so as to follow. So in that situation, it becomes very primarily important that we have the
Hmm.
access to the data, and social
Yes.
media gives us that freedom. So definitely, we can have moderation over the consumption,
Hmm.
but not total boycott.
Okay, okay. So we can say that everything in limit is fine.
Yeah, yeah, sure. Yeah,
Okay.
absolutely.
Okay, so sir, let's move on to the next very important question. What
Mhm,
books or resources do you primarily use for preparation?
mhm,
So
mhm.
please,
So, yeah, your voice was not audible at last, at
yes,
the
sir.
end.
Let me speak again. What books or resources did you
Mhm.
primarily use for the preparation? Please suggest some books, sir.
So the thing is, this process also has now become uniform. Like earlier, there were multiple resources which we needed to follow. To be like very crude, the
Huh.
initial years of my preparation, like for first year, was exclusively based on VK Chauhan sir's book. Okay, so it
Yes.
was really helpful for the
Huh.
beginner, especially given the way of presentation. Like there are questions and their explanation is there. So
Hmm.
I didn't have any prior understanding about this exam as such.
Hmm.
So to go through those questions really helped initially.
Hmm.
And as we moved forward, and I tried to contact, means try to gain the resources where the other people are like using. So got to
Hmm.
know, introduce about many other literature. So to sort it down, I feel like for homeopathic, it can be like segregated in homeopathic as well as non-homeopathic part. So for homeopathic part, one of the book which I found very useful is the all volumes, like 3 volumes earlier of Success. Now it is 4 volume Success book, and there is one supplement along with it also. I'm mentioning it. The name is Golden Points because it is just a
Huh.
compilation of single line answers of all the previous year questions. and especially for like now that there is 1 month remaining, so one can use it as a like pointer or to revise. That supplement is also useful. And for Materia Medica, there is no alternative than to read the crack the entrance. Apart
Hmm.
from the basic source books, like Allen's Keynote and Boric. So mainly questions are framed from these two books only. Once in a while, they ask few questions from Kent's Materia Medica or Nash. But overall, if the knowledge from the Allen and Boric's Materia Medica is there, we can correlate accordingly and answer. So for that reason, the Crack the Entrance book is very nice, especially the previous questions revisited section of the Crack the Entrance first part. So that has got many pointers that in the form of recaps. It
Hmm.
is very snapshot way of revising the Materia Medica. And as many people
Okay.
tell, the way to
Yes,
study
sir.
Materia Medica is through comparison. And so comparative Materia Medica is very much possible using like while studying this portion from the Crack the Entrance. Then this is about the homeopathic part. And for non-homeopathic, obviously there will be like differences. First will be, am I audible? Am I audible, Dr. Mansi?
Sir, connection is slightly lost from your end.
Okay, okay. I'll try to. Okay, how is it? Is it okay
Yes, sir.
now?
Yes, sir. Now
Okay.
it is fine.
Okay, sorry for the interruption. So
No,
for homeopathic, yeah, so homeopathic success, and I'm narrowing down because
sir.
there are alternatives to success book as well, like Kaizen is there. Then
Yes,
Turning
sir.
Point was the another book. So
Hmm.
so amongst these, just look in the type of writing that you prefer, and then
Hmm.
you can choose one. And for Materia Medica, crack the entrance. And for
Hmm.
non-homeopathic part, like Rome's is very concise and crisp,
Hmm.
because it involves the like high yield points in boxes as well as charts and tables. So those are very easy to remember at the last moment. So that is one of the thing. Additionally, there
Hmm.
is a SARP series, like self-assessment and review series from JP Publication. So that is also very useful, especially for the subjects of obstetrics and gynecology,
Hmm.
Sakshi Arora, and
Yeah. Okay.
the for PSM, Dr.
Hmm.
Vivek Jain's. So that book really helps out
Hmm.
you to revise the portion. And while we are mentioning all these source books, all these reference books, it is very imperative to have the like backing in the source books,
Hmm.
because in case of conflicts or any like challenging situation where the question is having conflict, so
Hmm.
the final authority will be to the textbooks. So at the end, after we prepare, while just it is very like advisable to go through
Hmm.
the like source books to confirm the answers.
Yes, yes,
And
definitely, sir. Sir,
yeah,
for the reference, I'm going to share my screen so that participants can get the idea of the books.
okay.
Like this one, these are the few books that sir has mentioned. Like we have Kaizen. After that, this is UPSC and MD from Dr. VK Chauhan sir. It is available in the three parts. Sir, is my audio is audible?
Yeah, yeah,
Okay,
it's fine.
okay, sir. Next we have New Heights. Then we have
Yeah.
4000 MCQs in homeopathy, and the another one is Crack the Entrance.
Yes.
That You can find on BHMS and as well as the Homeopathic Amazon. And sir, I have
Mm.
seen that in this book, a lot of theory and comparison between the medicines it is given there. So it is very a
Yeah.
nice book for the MCQ examination, homeopathy for UPSC, KPSC, RPSC, and MD entrance. It is a very nice book.
Yes.
And next, if I would like to mention that next in the market we see it's a here is a new book that is Achievers.
Okay.
Achievers is also a very nice book. It has numerous MCQs. Even that I have also seen that the when there was a MO exam in the UP, some questions were repeated from that book.
Mm.
So
Nice.
in this way, we can see the importance of preparing yourself through the numerous questions and previous years question banks.
Sure.
Okay, let's move on to the next question, sir. So, how did you divide your time between theory and MCQ practice?
Okay, okay. So we'll get to it shortly. Before that, I want to like let you know about the process.
Hmm.
Whenever we are getting into any exam, I feel like we should have the proper understanding of grammar of that subject as such.
Hmm.
So grammar per se is like structure of the
Uh-huh.
question paper as well as the structure of the curriculum.
Hmm.
So if we shortlist our like focus using that, then it becomes more easy for us to like divide our time as well as schedule
Hmm.
accordingly. So, like for example, majoritarily this exam has got the portion which is memory based, and there are some aspects of it which are having reasoning to it. That too, reasoning sequencing means we can say that more than having apart from the clinical questions, it would be like the questions will be framed in order to test your sequencing abilities, especially now that the assertion reasoning questions are there, and there are questions and having multiple options. The options are to be chosen from uh, like AB or ABC or all of them, like that there will be the options. So in that situation, it is very like important for us to like understand the grammar of it. Am I audible?
Yes, sir, you are audible.
Okay. So, so for that reason, we should have the idea of the blueprint of the exam first. So there is like since last 2 years, NCH is giving like blueprint for the AIPGT subject-wise breakup they have given of the 120 questions, out of which practice of medicine, materia medica, organ on repertory carry 16 questions, followed by homeopathic pharmacy has which has got 12 questions. Then obstetrics and gynecology, FMT, I have classified them in some like groups so that we can prepare them accordingly. So obstetrics and gynecology, FMT and PSM together have 21 questions. Then anatomy and physiology, together 5 each, so 10 questions. And then pathology and surgery, they carry 13 questions. So this is what the breakup which has been given by NCH for the blueprint. So this is the first thing that we can go through. Second thing is that assuming that we need the admission to the government institute. So that is the purpose. So in that situation, if we go through last few years, ranking list or the ranks at which the students got the like government institutes,
Hmm.
so we can shortlist it to be the markings, like minimum percentage of marks which have been able to secure the government seat has always been around 65 to 75, and more so like above 70%. So and before that, the government seats through AACCC, there are, I think, around 134 like seats are there, out of which 79 are for central institutes, and others are for the 15% seats in state government colleges. So in that situation, it is very important for us to realize how, like, because it is a competitive exam, so the candidates which would be preparing for this exam will have like that target, like 134 all over India seats. And even if we combine the seats from the other states, then also it will be around 250, 200 to 50 seats altogether. So at the same time, there would be minimum 250 students or candidates who will be preparing very seriously towards the cause. So that's the level of preparation we must have in before our mind before starting this preparation. Then cut off, like for example, I told like around 60 to 65% will be the one bracket where major cluster of candidates land up into, and that will equate at around the score of 288 to 312, which roughly translates into for example, there will be more around the rankings will be around 50 to 100, 200 students will be there in that rank range. Then when there will be 70 plus bracket where top 10 or top 20 candidates will means it's the pattern that has been observed. It will differ definitely as per the difficulty of the subjects, like difficulty of the paper during that year. But overall, this is the pattern. So in that situation, 336 or that is the like marks. So if we like narrow down everything, it becomes that it is very important for the candidate who is like aspiring to get seat in government homeopathic college or institute. They should have overall idea that at least 85 plus questions are needed to be correct. So
Yes.
this is the one benchmark that we can set, and with that 85% like bracket, then 85 questions to say, one can take some risk. Like for example, for after 85, every question will decide your like position in that thing, and this is the only like denominator or the modality which is in our hand. Like we can only focus on getting the questions right, and like focusing on minimizing the mistakes. So by that manner, we can focus on the 85, like 80 to 85 questions. If we can get right, then the margin of risk taking can be reduced. Like at max, we can attempt around 15 to 16, 17 questions. That too through the process of elimination, as previous speakers may have also spoken about, and it is well known thing for attempting the MCQ based exam, is that we need to narrow down the options like by eliminating the wrong ones. So at least we need to eliminate two wrong answers so as to arrive at the probability of 50%, of which one can be attempted having like some precursor knowledge to it, or if there is some logical sequence to the question and the options. So on that basis, we can attempt. So this is the precursor we can have in order to like start the preparation. Like this is what we can carry at our back end, that this exam needs this level of preparation. And overall, like whoever is preparing seriously are more likely to get 60% or 60 questions correctly, because the difficulty level will be shared one. Like if there are 120 questions, 60 questions will be around average to easy ones. So in that range, many people will cluster around. Everything depends, like the further process depends upon how many correct questions or correct answers you are able to do after that 60 bracket. So it's about 20 to 25 questions to say or to narrow down. So this is it.
Okay, sir. So
Then
you just shared a very important information. So,
Mhm,
sir, as we are talking about the number of questions,
mhm.
so sir, can you give us an idea about how many questions that we should
Ah,
to
so
get a
that is the thing.
seat?
So that is the thing. So we first of all, the thing is, it is about surety. Like if you are precise about or sure about the first attempted questions, which we are like while attempting exam also, if you will have some instincts and through which you will or gut feelings through which you will narrow down to some answers. There will be some direct questions. So in that situation, while getting the overlook, if you are crossing around 60-65 questions, then definitely like you can gauge the difficulty of that question paper, and accordingly you can like modulate your attempts. Okay. And as said
Hmm.
earlier, that given the trends that 80 to 85 questions,
Hmm.
like 80 to 85 answers, if you are getting right, it is almost getting you assured of the seat in the government institutes. So the purpose should be to reach to that level, like to that attempts at least. Like
Okay.
even in worst case scenario, we must have
Hmm.
at least around 80 to 85 questions to be attempted. Additionally,
Okay.
like I said,
Hmm.
for the rankings and all, like 15 to 16, 15 to 20 questions can be attempted in excess.
Hmm.
In rare cases, because there would be 10 to 20 questions which will be very difficult, or if not difficult, would be lengthy to attempt. Because there
Hmm.
are 120
Yes,
questions and
sir.
120 minutes. Yeah, so there are
And
120 questions
sir,
and
we see, and sir, nowadays assertion and desertion, these type of questions are
yeah,
coming. So these questions take long time to,
yes, definitely.
confirm the answer.
Definitely. So for that reason, the revision becomes very important. Like there will be one-liners in the question paper. If you have revised enough, then you can attempt that
Yes.
question within seconds, like 5 seconds, 10 seconds, and you will buy the time in order to like utilize it for the other
Huh.
lengthy questions. So that is very important. Like we need to buy the time, and that's where the revision comes into like handy.
I think your connection is lost.
Okay, wait.
Hello, sir.
Yeah, am I audible now? Wait, hello. Am I audible?
Yes, sir. So let you again.
Yeah, there are some network
Am I audible
connectivity
to
issues.
you, sir?
Yeah, yeah, you are audible,
Yes,
but
sir.
there are some connectivity
Okay.
issues.
Okay.
Sorry.
Yes, sir. Yes, sir. So, sir, moving forward,
Okay.
sir, did you follow any daily or weekly study routine?
So to be honest, I was like I have been like not prompt, with regards to the scheduling, but it is very important to have a certain set of schedule, especially given the limited time period for the preparation.
Okay.
So for that reason, at least I can advise that like as per the like subject breakup, there are two subjects which are very essential, and we
Hmm.
can't skip those subjects, which are practice of medicine and homeopathic materia medica.
Huh.
So it is very important to have 1 hour or like one stipulated time period for
Hmm.
practice of medicine as well as homeopathic materia medica on a daily basis.
Hmm.
And additionally, you can have the bunch like earlier I told. I can like group into 2 to 3 groups. The one having practice of medicine and materia medica, another one being organon, repertory, and pharmacy. So which will
Hmm.
have like this is one subject which this is one group where the participants or students can attempt many questions, and here is the role of revision and precision, where we can't miss any questions, because most of the students will attempt these questions. Then
Mm,
would be obstetric gynecology, FMT, and PSM. From
mm,
non-homeopathic part, these are the three subjects which you can score because of their nature. Like mainly it is like content oriented, data oriented,
mm,
and like it involves like some memory techniques. So you can directly have this certain set of schedule and cover it,
mm.
and it can you can revise it regularly so that you can at the end you can bank on it. These are those subjects. At the last, it comes the subjects like anatomy and physiology, which as a graduate we go through. Like these are the first subjects which we go through, but
Mm,
eventually some facts we tend to forget. So in that
mm.
also, if we can narrow down to some topics which are high yielding, like for example upper limbs and brachial
Yes.
plexus, or
Ah.
muscles of extremities,
Mm, mm,
especially for lower extremities like hamstring muscles, or like the sets of muscles, their relationships, their origin insertion, as well as relationships of organs and blood supply, as well as the dermatomes like nerve supply, sympathetic nerve supply, as well as the dermatomes. And at the end, brain, which is like circle of Willis and other associated like foraminas of skull. So these are few topics which are very frequently asked, and you can
mm.
revise as well. So that, but still, I would like put these subjects below the clinical subjects of obstetric gynecology, FMT, and
Mm.
PSM, because those are like those can be remembered very easily. So
Yes, sir.
and
So,
at the end, like
yes, sir. Yes, sir. Please say.
and at the end, patho and surgery. So pathology and
Mm,
surgery can also have the correlation where the tumor markers, or like most common like the questions involving the most common site of lesion, most common
mm,
cause, most common site of bleeding, all the most common things, or triads or signs, all these things can be covered. So these subjects like in case of last minute preparation, even if the preparation is a little bit less, then also we can focus on these high yielding topics and then gain most of it. But there are like particular subjects like organ and repertory, homeopathic pharmacy, as well as obstetric gynecology, FMT, and PSM, where we have to focus our like chunk, because it covers around 44 plus 21. So around 50, 65 questions are being covered in this chunk, and it's better to focus on these topics which are easy as well as replicable. So for that you can keep schedule. And so as said previously, practice of medicine, materia medica as a daily routine, and these other bunches either in the form of bunch or segregated one subject together. So three subjects per day would be more than sufficient. And one last thing regarding the pathology, physiology, and medicine can be studied together in the form of systems. Like all the systems can be covered as per their physiology, pathology, and then
ah,
medicine part. So that can be done.
okay. So we can definitely try this schedule. And as Dr. Saurabh Patil sir has earlier said that giving preference to some subjects for some days or few weeks, it will be very beneficial. Like he said, giving preference to materia medica and practice of medicines because they cover a lot of percentage. So in this way, this schedule will be very helpful for all the aspirants. Next,
At the same
moving
time,
on. Yes, sir.
one short note, like at the
Hmm.
same time, practice of medicine and homeopathic materia medica, these two
Hmm.
subjects are the ones where we tend to forget a lot or make mistakes.
Yes.
So that's
Yes.
why, although the weightage is more,
Ah,
here
ah.
is what the rank is being decided. So
Hmm.
that's why you
And
keep it in really routines.
sir,
Don't.
these subjects all huh. And sir, these subjects also carry the chances of confusion. Like there
Yeah,
are lots of tests, and there are lots of medicines plus medicines relationships and their clinical indications.
sure.
So that's why
Correct,
these
correct.
two subjects require more time for the
Yes,
preparation.
yes, 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 correct.
Okay, sir. Next, moving on. Sir, what role do previous year papers and mock tests play? You have also earlier said that during your class with your teacher, you remember a thing that
Yeah,
came up in your exam. So, sir,
yes, yes,
is
yes.
there any importance of previous year question papers and mock tests?
Definitely,
Mm-hmm.
because we are like this MD entrance exam is still in its nascent stage
Hmm.
to say, like
Ha.
say from 2017 till now, it still hasn't crossed many years of
Ha.
scrutiny. So it is
Ha.
still evolving.
Hmm.
So while it is evolving, it is imperative that there will be repetition of the questions. If not
Hmm.
the questions, the pattern of
Ha.
questions.
Pattern.
So there are around 20 to 30% of chunk which gets
Ha.
repeated.
Yes.
So, so that's why previous year question
Hmm.
paper is essential. And as I said earlier, the
Hmm.
grammar, like we get
The
to
basic structure.
the nerve of
Hmm.
that subject, like which subject carries
Hmm.
which points. Like
Hmm.
for example, for practice of medicine also, like there are topics like say, CVS, then
Hmm.
CNS, then GIT to
Hmm.
some extent. Like these are the topics from where more number of questions are being asked, and connective tissue disorders, so and genetic disorders. So there are
Ha.
some areas from where for example, there is one famous saying that 20% of syllabus or 20% of things carry the 80% of weightage. So does anyone know what it is exactly? So
Yes,
it is
sir. These
yeah,
questions
so
are sometimes we call them surprise questions.
okay. No, I was yeah, yeah, absolutely. So this
Ah.
20% thing, there is like chunk of syllabus, like 20% of
Hmm.
syllabus, on which the 80% is more likely that around 80% of the questions are framed. So this
Hmm.
is nothing but the Pareto principle, where
Hmm.
you need to have some homework before getting into the preparation, that
Hmm.
which are these 20% of topics. So
Hmm.
that so in that like parlance, I'm saying that you need to focus on those topics of each
Ah.
subject. And for few subject it is not required, like for example short subject like homeopathic pharmacy or
Ha.
FMT, which
Hmm.
are like concise in themselves, so
Hmm.
anything can be asked from those topics.
Ha.
But for subjects like practice of medicine,
Hmm.
surgery, which are very extensive, for that, for those topics, we must go through the previous year question papers and narrow down the topics. And at the end, the preparation never gets complete, to be honest. So
Yes. Yes.
to stress about yeah, so to stress upon the completion of each and everything will be more bothersome, especially at during the last minute preparation. If you are preparing for one whole year, then definitely I would
Hmm.
definitely advise to cover entire syllabus. But this is
Hmm.
like a rescue thing. Like at last, if we are not thorough with entire preparation, still we can get closer to the benchmark. So using this technique, like the topics which are frequently repeated, and we can go in depth of those topics rather than going for some rare topics and spending our time, just because like sometimes it happens policy that we like some topics, so we tend to give more time to it. So that's also is one thing which we should avoid while preparing, that not
Yes.
to get
Ha.
too close to any topic per se.
Okay, sir. Okay, sir. Thank you so much, sir, for sharing your this important trick. Next is, let's move on. So, how did you stay motivated throughout your preparation? We all know it is a very difficult time to stay motivated for the whole year or for many months
Mhm.
sometimes. So, sir, how did you do that?
Mm, Honestly, I did not. So
Okay.
the thing is, so it's not possible for anyone, or it's not a human quality to stay motivated all
Ah,
the time. So
yes,
it's
yes,
human
yes.
to break down. It's human to
Hmm.
have some insecurities, to
Ah,
have doubts upon yourself.
ah,
So the thing is, there will be something which you will bank on to in order to have some hopes. Like for
hmm.
example, for my thing. the
Hmm.
exclusive purpose of getting into MD was to get some good clinical exposure in government institute. Like
Hmm.
government institute was also not the criteria. The criteria was to
Hmm.
get good clinical exposure.
Clinical
So
exposure.
so if that is not being, so that is if we are not getting like for the states of Maharashtra or
Ah,
Karnataka,
ah.
like there are states where there are still we don't have didn't have government homeopathy college till
Hmm.
last moment, till last 2 3 years. So in that situation, it becomes
Hmm.
the thing like the source of motivation. For
Hmm.
some other people, it could be like some achievement, or maybe it can be varied. So it is very variable to have the source of inspiration or the motivation. Somebody might be proving something to
Hmm.
themselves or to others. Somebody might have monetary, like that's also not wrong to have like as a banking thing. Like for example, someone if someone is having motivation to like study PG and having the
Hmm.
motive that stipend is the thing, so we can't judge moralistically, because if that motive is getting him through the like purpose, then it is fulfilled. So motivation can be varied, and at the end, it is very important to surround yourself with the atmosphere where you can still have doubts upon yourself,
Ah.
but at the end of the day, you will have that self belief that okay, I'll overcome. So that is very
Yes.
important.
Okay, sir. Okay. Thank you so much, sir. So, sir, we can say that good environment and positive surroundings are do also play important role in the preparation.
Yeah, sure.
All right. So, moving on. What are the most common mistakes AAPGT aspirants make? So, can you please mention so that uh,
Mhm.
future participant will not do those mistakes?
Yeah, so like this can be again classified into like first like, or we can see it through two perspectives:
Hmm.
mistakes in preparation and mistakes in attempting the questions.
Yes.
So so while in during preparation, same
Ah.
thing as mentioned earlier, we can't stick on to few topics just because they are having some, like you are liking them, or you
Hmm.
find them easy, or you find them
Ah.
interesting. So
Hmm.
it is it might be good for a clinical purpose or some other
Ah.
purpose, but
Ah.
for this exam, we must stick to the plans, and we must cover all the, like it should be in the form of checklist. Whatever it is, we should have particular checklist for the stipulated syllabus,
Hmm.
and then we need to cover everything and keep on revising. So revision, if we can summarize this whole process of preparation, we can summarize it in one word only, that is revision. So the major difference is between the people who revise frequently and the people who don't.
Okay.
Okay, so that is very sure, because at the end, many people might have good memory, many people might have good grasping capacity, but if we are not revising it properly, there is like the forgetting curve, the Ebbinghaus curve.
Hmm.
So there is the significance of the like repetition. So repetition and revision is very essential, especially in the pattern of that. Like first you read the topic within 24 hours, then after 1 week, and then 1 month, you can have that schedule where you can revise. And as we move forward, the time
Hmm.
for revision also gets reduced. That's also one very good thing, like you can recall it more frequently, more easily. So that
Yes.
is one mistake which mistakes, or per to say, we can implement in the things which we can implement in our preparation. And then second thing is, while attempting the questions, the freshers might tend to attempt in overconfidence or anxiety, both
Hmm.
way, like both spectrum. In overconfidence as well, we can tend to lose the things, especially while reading the question. As
Yes.
simple as that. Okay, the question may carry that which all of the following are having particular trait.
Hmm.
At the same time, it may also have except. So
Accept.
if we
Yes.
don't read that except or all,
Ah. Ah.
if we go through some options, and we know that okay, this quality is there in
Yes.
that remedy, or this thing is there in that clinical condition, so we
Ah.
definitely the overexcited or that
Hmm.
anxiety, both way, can lead us to some wrong selection.
Yes.
So
Yes.
first quality is to read the question very carefully,
Ah.
and then there are other things, like for example, uh, for repeaters, like this is for the freshers and novice. For repeaters, there are some other downflips. Like now that they have experienced some, not to say failure, but experience of not getting qualified, the
हाँ.
next attempt becomes more so difficult because they tend to overthink. So while attempting as well, we tend to overthink upon the questions. So that is also very like important for to remove that aspect of it. And that's why like simple breathing exercises or simple meditation comes into play. Like even before the exam starts, there is a like time period of around 20 minutes which we get. So even in that duration, we can do long breathing and calm our nerves. Basically, if we can get into the parasympathetic state of mind, where we can like calmly think
हाँ.
rather than getting into that like primeval like animal instinct, fight or flight,
हाँ.
we must get into that calm state, and that calmness will help us to process the things properly. So for both novice as well as for the repeaters, it is very important to be in the present while attempting the questions. So, and basically keeping it simple while attempting.
Yes, sir. So this is the way. That's how can we avoid our silly mistakes.
Yeah.
Okay, sir. So, sir, in the end, would you like to share a general tip to the our future aspirants that that plays a major role in your preparation, or
Mhm.
do you want to give a tip from your experience that maybe few mistakes you have done in your preparation so that others don't do that mistake? Would you like to give a general tip to the students?
Yeah,
Any tips?
actually the heading of this could have been like the mistakes which you should avoid. Like I have enough
Yes,
experience of
yes.
doing mistakes. So the thing is, at the end, like mistakes are what teaches you. So there are multiple mistakes that we tend to do. So first of all, like from outset itself, we should be very clear about what our purpose is.
Hmm.
So if that purpose is to get into the government homeopathic college, be it that,
Hmm.
because we the goalpost keeps on changing. Like for example, sometimes during the preparation, people might think that okay, never keep any option. To be honest, like if we keep any option, like I have other clinical practice with me,
Hmm.
so if this doesn't work, I will go to that. Or per to say, I have some other like if not government, I will shift out to the private medical college. So
Hmm.
even that is not a bad thing. Actually, private homeopathic medical college also
Hmm.
have got their own plus points, where there is a possibility of like developing their own
Uh-huh.
clinical practice along with the normal curriculum. So there is nothing wrong in doing the PG in private homeopathic medical college. But my precursor to this curriculum is that we have already learned enough things in
Hmm.
BHMS. So normally we do study the basics of all human sciences in our graduation. So the MD should be the upgradation
Huh.
over whatever we learned. And that
Hmm.
upgradation for me primarily involves the clinical experience. So it might
Hmm.
differ, the definition definitely might differ for person to person, but that upgradation in the form of knowledge, in the form of clinical exposure, if we are getting anywhere, so we need to focus on that. We need not distract ourselves by like complacenting. Like there will be complacency during the
Hmm.
preparation. During that time, we should fix the goal at first itself, that I want this, and then keep on. And this is very tedious thing. Like it is
Hmm.
boring thing, because routine is always boring. And so in order to embrace this boringness, we must have that discipline. So the revision, discipline, and consistency. So
Consistent.
these the three qualities which we definitely can like inculcate, and it will also like translate into the other
Hmm.
aspects of our life as well. So it some way or other way, it teaches this preparation teaches you a lot.
Okay, okay, sir. Thank you, sir. And sir, you wanted to give some idea about the institute that we are doing PG. So would you like to share some
Mhm.
ideas regarding institute?
Yeah, so for example, like the institute that which I am studying right now at is National Homeopathy Research Institute in Mental Health,
Hmm.
which is at Kottayam. So it's
Hmm.
amongst the central and
Hmm.
national universities. Yeah,
Hmm.
like there are four as of now, like NHRMH, then NIH Kolkata, then Northeastern Institute
Hmm.
Meghalaya, and then NIH Narela.
Hmm.
So apart from them being national institutes, the main
Ah.
thing is again the clinical exposure. Like for example, JSPS Homeopathic Medical College also has got a very good clinical exposure,
Ah.
so that can also be preferred over like it depends at the end. It depends upon your
Hmm.
priority where the
Yes.
locality you want to set and all. So as far as the this institute like Kottayam Institute is considered, the clinical exposure in psychiatry is very nice. There are things like apart from the like therapeutic aspect of the treatment, there are many allied aspects involved. So especially medical legal things like human rights and mental health is one of the priority which is
Hmm.
emerging right now. So we
Yes.
get to know the sensitivity with which we need to deal with the patients,
Hmm.
participants, cases, patients, the sensitivity with which the responsibility with which we need to handle the critical situations, and these things can be learned better way in like every institute will have its own pluses. So this institute being the research institute as well follows the ethical guidelines very stringently. So the ethical practices and which are very basic things, and for like now that human rights and normal like basic rights are being considered, these are needed. These are some good clinical practices, a part of good clinical practices which we can follow in our private establishment as well as wherever we go. So these are some things, and additionally there are some cases which we might never get to see, like terminal psychiatric illnesses such as schizophrenia or
Okay.
bipolar affective disorders or convergent
Yes.
disorders, even like trivial substance abuse things, but
Huh.
they may lead to some psychotic symptoms. So these are some cases which are very frequently encountered here, and this is one of
Hmm.
the good experience. Like this experience we might not have if we start like practice at from scratch.
At our and sir, we see we did not or we can say it is very rare to see these cases in our private practices, but
Definitely.
the institute which is specially made for these type of cases, it is
Yes.
then we will be very lucky.
Yeah, sure.
Okay, sir, so thank you so much. You have shared so much knowledge, important instructions for the syllabus as well as the pattern of the paper, the blueprints, and whatnot. It was a very interesting session. So, from the attendees, I would like to ask, they want to ask any questions or any doubt. Like Shanti is saying, if practice MCQ is enough to get good marks in exam.
Again, it depends. No, for example, how you approach the MCQ is also very important. Like
Yes.
I can say yes to this answer as well, where if you are segregating, like if you are taking one question and then segregating it into four options, and if you are like critically analyzing why this option is being put in this question, like especially for materia medica, there will be like one symptom would be associated with the multiple remedies like dreams that she is drinking, which is in case of medorinum. So similar set of symptoms will be there in phosphorus and other medicines. So we must have like some while preparing, if we are going through every option, and if we are at that moment itself, if we are going to the source books and checking why that option is being put in that, then you will cover most of the syllabus. So that approach is like this is kind of reverse engineering, where you are not following the syllabus then questions, but the questions and then like doing the reverse process and then reaching out to the entirety of the syllabus. So that can also be done, but it requires patience as well as that approach is somewhat we need to give more time. Yes, doctor. Am I audible?
Yes, sir, you are audible.
Okay.
So, so it was a very nice session. Thank you so much, sir, for giving us your valuable time.
Okay, thank you once again. Actually, to conclude, I wanted to say that every beginner or every graduate begins with their preparation or their studies in homeopathy through the books published by BHMS itself. So it was really an honor to have contributed to their content, and especially the back end work that is being done to get into this whole activities is really appreciable. I would like to thank Dr. Dinesh and Sandeep sir, Dr. Mansi for giving me this opportunity. And I also hope that you keep on doing these things. And actually, this is the way in which the things are getting accessible. Earlier, the access was very limited, and now that these things are being provided free of cost, there are multiple other content from the stalwarts, the current stalwarts, which is available on the website or other social media platform from Homeopathy 360. So it's really commendable effort from your end towards the development of homeopathy, and I'm really happy to have been part of this.
Thank you so much, sir. Thank you so much. Even sir, we are very grateful to have you on this platform. Today you shared a lot of knowledge and tips and tricks to the aspirants. We will be very grateful always. And we are really happy to have such passionate and such brilliant doctors in this field of homeopathy. And because of you and your other doctors and friends, this homeopathy is going to spread more and more in all over the world. Thank you so much, sir,
Thank you. Thank
for
you very
giving
much.
us your time. Thank you, sir.
Thank you.